Welcome to High to High. I'm Giuseppe Querques. Today I'm talking with Dr. Rosa Dolz Marco about some of the latest innovation in AMD. Rosa, what do you mean when you say multimodal imaging?
When I'm say multimodal imaging in AMD nowadays, so I think first of all we are really lucky because we have a bunch of modalities that we can use. First of all, I use a lot spectral domain OCT or swab source OCT on the structural basis. Also, with the advent of OCTA, we are really lucky because we are learning a lot in the last few years. Still, we use fluorescein angiography and indocyanine green angiography for challenging cases. And we also have really specific features like high magnification module, adaptive optics. We have also functional modalities as microperimetry. So we have really a lot of options that we can use in order to really assess all the details in our patients and assess really carefully the prognosis in the patients.
So we have so many tools, and this is multimodal imaging. But considering all these tools and all these new imaging modalities, what is your standard workup for a new patient with AMD?
Basically, nowadays on AMD patients, I use structural OCT. We used to use a lot fluorescein angiography, and in some countries is still needed in order to start treatment with anti-VEGF drugs. But in Spain, it's not the case. So we use we use structural OCT as the main diagnostic tool. We also use nowadays OCTA because it's really a trending modality. But I think we still have to learn a lot on this technique.
So the standard is fluorescein angiography, I guess.
Well,
Do you agree with this statement, or do you think that OCT angiography may replace FA?
I think it's OCTA is completely different compared to fluorescein angiography. It allows us to see the vessels, of course, but we are seeing completely different things because we are seeing molecules moving inside the vessels, structures moving like erythrocytes, but we are not seeing the staining or leakage, etc. So with fluorescein angiography, we have really another information complementary to the OCT angiography or a structural OCT. But I will not say it's nowadays the gold standard because I will say structural OCT has replaced completely the use of fluorescein angiography. We can diagnose really early every patient with exudation and all the activity, and we can really follow up in a better way compared to 2D images that provide fluorescein angiography.
Fantastic. We have learned a lot about your published study on histopathology. I mean, you were able to put together histopathology and in vivo or ex vivo information from clinical imaging, like OCT. So, do you think that the information that we have got thanks to combination of histopathology and in vivo ex vivo imaging may help us to manage our patients nowadays?
Yeah, so, this work was done with Dr. Freund and Dr. Curcio in a combination from the University of Alabama and BRM at New York. And I was really lucky to be able to collaborate with them. So we have learned a lot. And of course, helping in the management of our patients is really difficult. We learn really step by step, and it's really a slow process. But I think all this work where we have compared a long follow-up in our patients with multimodal imaging in the clinic, and then after death, the same eye was analyzed on histology. I think we have learned a lot on the prognostic value of really detailed features that we see in OCT or autofluorescence that we were not really able to understand before we did these studies. So I think the detailed and careful analysis that provides this kind of studies is really helpful in our improvement of the knowledge that we have nowadays on AMD cases.
Thank you very much.